The coronavirus cases surged nationwide. 11 states are now reporting record high COVID-19 hospitalizations. Hospitals in Utah are now over capacity, rationing healthcare workers and sending patients to overflow beds. ABC's Matt Gutman is in Salt Lake City with the latest from there.
Hey, Terry and Diane. I'm here at the Intermountain Medical Center in Salt Lake City. Beautiful day, sunny outside. The news, however, coming out of the Rocky Mountain area, as you know, is not so good. The caseload here in Utah and in surrounding areas in Nevada, Wyoming, and Idaho is really bad. A significant uptick. And nurse manager Sean and Michelle, they're both trauma nurses at the ICU, and they've been dealing with this pretty much every day for the past 7 months. So I'm just going to ask you, one of the things that we talked about is that people here in this part of the country believe that COVID is a hoax. What's your take on that?
I would say it is not a hoax. We deal with it every single day, and the nurses go in and take care of very sick patients that have got this disease, and it complicates a lot of other illnesses that they also have going on, and it's very real. We deal with it every single day.
Yeah, it is definitely not a hoax. We see it every day in our ICUs, and it seems like it's not ending, and it's getting worse.
How sick are the patients when they come in to you?
So do you want to?
They're very sick patients, and the thing that's really terrible about this illness, it seems like, is they come in and they deteriorate slowly, or sometimes quickly, but they deteriorate to the point where they get very, very sick, and they take a lot of care, and a lot of time is spent trying to deal with these patients.
One of the major concerns is that we're seeing this very significant uptick in new infected cases, which means in about 10 days to 2 weeks, these people are going to start coming into the hospital very sick. What is it going to look like in 2 weeks when you have another massive influx?
There's going to be even more shifting patients around and juggling of who's going to go where to which ICU. When we see
the president of the hospital is talking about rationing care.
The good thing about how we operate, especially here, is we have these very impromptu daily maintenance huddles where, from administration down to our nurses level, we have very short, fast conversations and huddles about which patients we have, where they're going to go, so we can take care of everybody, because we don't just take care of just COVID, we take care of the population as a whole. So our way to get around having problems like that is to just daily maintain and talk about where we're going to put them and how well we can take care of everybody.
Yeah.
How serious is the fatigue factor for medical staff? Because administrators at the hospital say we have the beds, we just don't have the people.
Right.
How tired are you guys?
We're exhausted, and I'm sure this is nothing new that you've heard this from so many people that you've probably interviewed. It is very exhausting. It's emotionally draining. Like our ER is suffering, our respiratory therapists suffer, our ICU nurses, our floor nurses, everybody. It's not just one section that the patient population is in. It is affecting the whole system, and it's
COVID patients are everywhere.
Right, and it's not just the COVID patients. We have our regular patients that we take care of too. So we've got your regular normal
People are still
stuff.
having heart attacks and car crashes and shootings.
So you still have all of that, and then you add this on top of it, and it just makes it a little more difficult. But our nurses are fantastic. Our doctors are excellent, and we just, every day we treat it like, here we go, we got this.
So when you hear that people are opposed to wearing masks, that they don't want to see any shutdowns, how does that make you feel?
It's a frustrating point to argue with someone about masks and hand hygiene and social distancing. We don't want to shut down life either. I think there's a fine line to be had and a balance to be had with keeping things open and staying alive and functioning, but being responsible and looking out for those around you and your family and yourselves. It's more than just about you. If you do these things, you can help other people. Yeah. I wish people would understand that.
Society and the community working as a team.
Oh, we need their help for sure. This is not just healthcare. I think we talk about that all the time on our floor. If the public could just help us with it, it sure would go a long way.
Yes.
And so one of the issues, Terry and Diane, is that folks, especially in this part of the country, are very reluctant to wear masks. And coming into the airport today, I saw people, as soon as they landed, they pulled down their mask, walking through the airport, talking on the phone. You see that pretty widely. And it is a major issue, especially with local politicians lobbying against, universal mask wearing. And that is something that administrators and the infectious disease doctors in these hospitals are just so despondent about, because if the public did help, it would really reduce a lot of the pressure on medical staff like Sean and Michelle right here. Sending it back to you guys.
All right, Matt. Yeah, it's a public health issue that unfortunately has become a political issue as well. Our thanks to Matt Gutman.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.